Hey, everybody, I'm joined here by Krista Park-Berry. She's the director of the Komen Breast Care Helpline. Thank you for joining us, Krista.
Thank you so much for having me today.
So tell me a little bit about the scope to begin with of the Breast Care Helpline. What do you do?
At Susan G. Komen, right, we unfortunately know that 1 in 8 women in the US in her lifetime at some point will be diagnosed with breast cancer. And for many, the path to high quality care is complex and challenging, even in the best of circumstances. So when we think about Komen's Patient Care Center, the helpline is that front door. It's the way that individuals, patients, families, loved ones can get connected to support, resources, information, and more.
So this is not just for patients then. This is for pretty much anyone that has a connection, if you will, to breast cancer.
Exactly. So whether it's someone who is young and trying to figure out their risk, when they should get screened, or where's a great place for them to find a primary care provider, to sitting with someone once they've been diagnosed or exploring clinical trials. We also welcome callers or people reaching out who are friends, loved ones, family members, knowing that as they support someone, they're going through their own journey too.
Now, you mentioned callers. I guess talk about how someone gets engaged with your program to begin with.
So lots of people know Susan G. Komen for our race and walks, right? So we've done a lot to bring breast cancer awareness. So we try to be just as accessible to patients. So individuals can give us a call, they can email us, they can connect through the website, but we are really readily available to anyone in whatever way they want to reach out. Our navigators, we have a team of navigators that are really trained to assess someone's individual needs, what their concerns are, and really help them create the best plan of resources or next steps for their care.
Interesting. All right. So now I'm based in the Metro Detroit area. Talk about where
Yes.
you're based and I guess the accessibility that you have to patients across the country.
Yeah, exactly. So Komen, we're working nationally across the US, and we really want to be here for a patient no matter where they are or where they live. That should not be a barrier to their health, getting access to information. And we know that there's lots of barriers that stand in the way. So again, picking up that phone or sending us an email can give patients a direct line to our navigators where we do provide that health information. We're there to listen and even just provide emotional support as they're going through this tough time.
Wow. Okay. So for patients that don't have insurance, how does this service work, or does it require any payment or insurance? And if not, how are you funded actually?
Yeah, no, that's a great question. Thank you. So the services we offer are completely free. So it doesn't matter someone's insurance status or documentation status. We're really here to get them connected to what's going to best support them for their situation and in their community. We're really lucky that Komen is well known, right? We helped kind of put pink on the map, and those race and walks, all those individuals that really come out to support patients and communities. That fundraising goes directly into the work that we do in the Patient Care Center. We have lots of great partnerships and companies and organizations that also give to make sure that, again, no matter where someone is, if they give us a call, the helpline is here for them.
So what kinds of questions are the most common that you receive through the helpline?
Yeah, no. So this time of year, right? October, it's Breast Cancer Awareness Month. Getting normal, regular screens is on people's minds. So the last few weeks, we've really been flooded with lots of calls for individuals seeking low cost mammograms, perhaps folks who are underinsured or uninsured, or just looking for a place to get connected in their community. We get lots of questions about, how do I know my normal? What's right? Is this what I should be expecting? How should I get care? That types of things. So our navigators really spend a lot of time providing health education around breast self-awareness. We also know that breast cancer patients have a lot to figure out when they're being diagnosed. so we can help them understand their treatment. We have lots of tools to support conversations with their medical care providers, and really there to help coach them. Here's some things they can know. Here's ways we can help them better get connected to their care, ask the right questions, and hopefully really feel supported and empowered along their journey.
Now, if someone does not have a primary care provider, then you must provide a great deal of information. If someone does have a primary care provider, I guess, how do you fit into that equation?
I mean, 9 times out of 10, we are always going to encourage that individual to go back to their primary care provider to really make sure the information we've provided and what we've discussed is in alignment with their care. So we're really here to help navigate, to kind of be that sage on the side as individuals just figure out our complex healthcare system, right? Where do I go next? Who do I need to be seeing? We also support a lot of individuals that are facing just the financial burden of their medical care and treatment. So those are frequent calls we get in terms of what resources do I have? How can I better utilize my insurance? Is there a different insurance plan I need to be on? Those types of things.
So I guess, across the spectrum of family, friends, patients themselves, or people who have never been diagnosed with cancer yet, what is the most common, I guess, consumer of your service, and who do you want to attract as well?
Yeah, so I mean, I would say we are really seeing most individuals when they are going through treatment and possibly newly diagnosed. We also have individuals who are living with metastatic breast cancer that also reach out to us that are adjusting to living with this disease long term and really wanting to make sure they're connected to the best resources and support available. I would say that we will open our doors to anyone. Again, family and friends, those really trying to figure out when to start their breast health journey. We know that screening can catch early stages or catch breast cancer early. So getting people aware of their risk, knowing what's normal for them, getting them into that care is really the best step towards reducing breast cancer mortality rates.
Yeah.
And people really successfully conquering the disease.
I'm really what the thing that I'm most impressed by is the scope of your services. Helping patients, financial assistance, getting them the most optimal treatment available in their area, perhaps, or nationally, I suppose. But also the emotional support aspect of it for friends and family. I mean, I guess patients obviously need emotional support, but the idea that a family member who may not know how to approach their
Yes.
loved one's illness, this may give them an opportunity to figure out how to best support them. Is that right?
No, that's exactly correct, right? Because often we think we're there to support individuals when we need some support ourselves. So oftentimes those loved ones and caregivers have a really hard time asking for support. But breast cancer is tough for anyone, whether that's waiting on a test to come back or waiting for that next appointment. Having the courage to support a loved one takes a lot. So we're here to help them address those emotions they're feeling and really figure out how they can best support their loved one.
You sound like you are really the one call breast cancer helpline for all things.
Yes, we really pride ourselves in being the trusted go-to source for health information, resources, support, and really do hope anyone will give us a call, email us when they're ready for the support they need.
How many calls do you get a year, would you say?
Oh goodness. So we average over 100 calls a day. So last year we supported almost 30,000 people through navigation services. Yeah, so we are a small but mighty team, social workers, individuals who've spent time in oncology and cancer centers that are really passionate about supporting patients and their family. And really for us, it's, we're really committed to health equity. We
Yeah.
really want to make sure every patient has the opportunity for the best care, and we're here to help bridge those gaps.
Well, in wrapping up, Krista, is there anything we didn't talk about that you want to highlight here that needs to be covered?
Yeah, well, I just want to say that, at the Komen Patient Care Center, our navigators, they're trained, they've had experience, they come from the communities in which we live. And they're really here to be that support person, or here to work with someone as long or as little as it's needed. Our teams are also bilingual in English and Spanish, so all of the services we provide are for English and Spanish speakers, and really just hope the community knows that we're here, we care about them, and connecting with the Breast Care Helpline is the way to get in, that first front door to care.
And real quick, what's the number or the website?
Yeah, great. So that people can call us at 877-GO-KOMEN, which is 877-465-6636. Helpline at komen.org is our email, and komen.org is where they can find us online.
Awesome. Well, Krista Park-Berry, Director of the Breast Care Helpline at Susan G. Komen, thank you so much for joining us and giving us really great information and an amazing spectrum of services you offer.
No, I appreciate your time. Thanks so much, Dr. McGeorge.
Hey, take care.